Now, Amnesty International is accusing 6 leading COVID-19 vaccine manufacturers of dishonesty and favouring wealthy countries. It has released a report called A Double Dose of Inequality. In it, Amnesty says these companies are fueling an unprecedented human rights crisis through their refusal to waive intellectual property rights to manufacture the jab. I'm joined by Shenilla Mohamed, who's the Executive Director for Amnesty International in South Africa, to discuss this further. Thank you so much for your time this evening. And I mean, perhaps you could just lay the land for us in terms of how bad the situation is when it comes to the vaccination drive, particularly for people in low-income countries.
Good evening, Rafiwa, and good evening to your viewers. Well, the situation is bad. I mean, we just heard President Ramaphosa talk about it. But, you know, according to our own analysis as Amnesty International, only 1% of people in poor and middle-income countries so far have been vaccinated, and this is compared to 55% of people in richer countries. So, I mean, it is just the gap is just phenomenal, and I think that, you know, our in a way calling out on these big pharma companies is really to stress the point that even during a major pandemic, when hundreds and thousands of lives have been lost, you know, we still have corporates that are focused on profit over life. I mean, the companies that we have cited in our report, by the end of 2022, they will have gained about $130 billion in profits from the COVID vaccine. And, you know, this is just, I mean, that is their main focus. And then, of course, we have countries that are hoarding, richer countries that are not releasing vaccines. And although today we saw President Biden and the European Union pledge a further 900 million vaccines to poor and middle-income countries, it's still not enough. You know, we still need at least 2 billion vaccines to come to these poor and middle-income countries if we are going to reach the World Health Organization's target of vaccinating 40% of the population of low and middle-income countries by the end of the year. The other big challenge is that even these pledges, they are coming really late. So if you look at the pledges today, they're talking about sometime in 2022, towards the end of 2022. Why? Why aren't they releasing them now? What is the delay? People are dying now. We need those vaccines in these poorer and middle-income countries now, as in yesterday.
Right, and now Amnesty International has called for about 2 billion vaccines to be delivered to these low and lower middle income countries before the end of the year. I mean, governments will need to come to the party and enforce policies that will make the pharmaceutical giants play their part in this. I mean, the buck stops with governments at the end of the day, does it not? These companies operate within countries.
Absolutely. And, you know, again, while we are calling out these companies and really asking them to show some moral and ethical values, given that we are in a COVID crisis, of course, you're absolutely right. The buck ends with the governments and with the governments where these companies operate. And I think that, you know, that again, our call is to the states. And you know, the reality is, unless the states and the pharma companies do start to behave differently, there will be no end in sight for COVID-19. And I mean, that is the harsh reality. So if people out there are thinking that, okay, well, I've been vaccinated, so, you know, COVID is going to go away. No, until we reach at least 40% of people in these poor and middle-income countries being vaccinated. And like I said earlier, we're sitting on 1%. Nobody's safe. And, you know, as the president said in the clip he showed, that it's a huge threat to global health security. So again, we need to ensure that not only do pharmaceutical companies behave appropriately and in a moral and ethical way, but so do states. And this is especially to the richest nations who, you know, even if the pharma companies don't come to the table, they need to pay for the vaccines and make sure that the poor and middle income countries get the vaccines, because their citizens won't be safe until everybody is safe.
And that's why you've described this as a human rights crisis. And it's very important for these companies to also share their technology on and knowledge on developing these vaccines so that developing countries like South Africa, as one example, can fast-track drives while producing their own vaccines.
Absolutely. And South Africa was in the forefront. The South African government was in the forefront of putting forward a resolution for a waiver for intellectual property rights at the World Trade Organization, but it is not getting the support that it needs to pass. So again, you know, these countries that are claiming that they care about poor and middle-income countries need to show this by putting the action to their words. We don't need empty words in a crisis. We need action. And, you know, the worst thing, Rafiwa, is that what they're showing us now is that, you know, people who come from poor and middle-income countries, their lives matter less than people who live in rich countries. And so, you know, this is an unacceptable human rights violation, and it's not something that anybody should be willing to tolerate. I mean, if you are somebody who lives in a rich country, you know, people should be feeling ashamed of their governments, of the fact that, you know, that they don't care about the lives of people in poor and middle-income countries. And it is really affecting people in Africa, Asia, and South America badly. And until something is done about this, you know, we are going to remain in a COVID crisis, and the variants are going to continue to show up, and, you know, people will not be safe.